This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydrogest ER Tablet is a hormonal therapy that helps manage progesterone deficiency in women. It alleviates symptoms associated with menstrual and reproductive health. Indications and uses. This medication is used to relieve menstrual pain, manage the symptoms of endometriosis, and address premenstrual syndrome. It is also beneficial for maintaining female reproductive health and alleviating menopausal symptoms in postmenopausal women when combined with estrogens. How it works. It functions by improving the thickness of the uterine lining, correcting infertility issues, and relieving postmenopausal symptoms through the restoration of progesterone levels. Directions for use. Take this medication as prescribed by your physician. Swallow the tablet whole with a glass of water, do not chew or crush it. It can be taken with or without food. Consistency is key, so try to take it at the same time each day. Your physician will determine the correct dosage based on your health condition and body weight. Possible side effects. Common side effects may include severe headaches, nausea, breast tenderness, and irregular menstrual periods. Consult a healthcare professional if any side effects worsen. Precautions and warnings. This medication should be used cautiously in patients with liver or kidney issues, and it is contraindicated in those with specific tumors or who have experienced blood clots. Always consult a healthcare provider before use. FAQs. 1. What is this medication used for? It is used to manage progesterone deficiency. 2. How should it be taken? Swallow it whole with water at the same time each day. 3. What are the side effects? Common effects include headaches and nausea. 4. Can I stop taking it once my symptoms improve? No, do not stop without consulting your doctor. 5. Is it safe for children? It should only be used in postpubertal female children if prescribed. Thank you for watching. If you have any questions or suggestions, please leave a comment below.